Hi, my name is Megan. I'm going to be your student nurse today. I'm going to provide patient privacy, do an environmental check, and perform hand hygiene. May I have your first and last name and date of birth, please?
Sue Jones, January 1st, 2000.
Thank you. Do you have any allergies?
No.
Okay. So could you please tell me where you are?
Utopia Hospital,
Could you tell me the day of the week?
Monday.
And could you tell me who the President of the United States is?
Joe Biden.
A patient is alert and oriented ×4 to person, place, time, and event. I was reviewing your vital signs that my CNA took as I was coming into the room. Everything is within normal range and you're stable, so that is good. Overall, how are you doing today?
I'm feeling good.
You're feeling good. So the patient mood is cooperative and has a positive well-being. For pain, on a scale from 0 to 10, how would you rate your pain?
0.
0, so patient is not having any pain right now. Okay, well, I'm here to perform a head-to-toe assessment on you. Do I have permission to proceed?
Yes.
Okay, so I'm going to start by just overall looking at your skin tone. I see that it's appropriate for your race. There's no jaundice, cyanosis, there's no edema. Face is symmetrical, no skin lesions or any issues. I'm assessing your hair for any lumps, bumps, or lesions, or scars, or infestations on your scalp, and none are noted, so all looks good there. I'm going to proceed by just looking in your ears, assessing for like excessive cranium or redness, irritation. Are you having any pain in your ears?
No.
Do you wear hearing aids?
No.
Okay, so everything looks normal there. And then for your nose, I'm just assessing that the septum is midline, that there's no polyps, there's no drainage, no issues there in regard to it's patent and there's no drainage and everything looks normal. So in your mouth, I'm just have you open up, stick your tongue out, up. Okay, you can close your mouth now. So the mouth is, mucous membranes are pink and moist. The teeth are intact. There's no cavities, no signs of infection, no gingivitis, no bleeding gums, no oral signs of oral cancer. The uvula is midline, and the tonsils are stage 1. So now I'm going to just move down to assess your neck. I'm looking at your neck for the trachea's midline and assessing for any goiters. Could I have you swallow, please? Okay, and there's no goiter that I feel. And now we're going to move on to your lymph nodes. I'm going to start with your preauricular, postauricular, occipital, the tonsillar, submandibular, submental, cervical, superficial cervical, the deep cervical chain, the supraclavicular. Did you feel any pain?
No.
Okay, so they're non-tender, non-palpable. Now we're going to move on to your carotid artery. I'm going to begin by just listening with the bell of my stethoscope for any bruits. Okay, and I'm also going to assess one at a time. I'm going to palpate. In the meantime, I would be listening, comparing it with her apical pulse, which would occur with her at a bare chest, but the carotid pulses are equal bilaterally to plus. So in addition, I'm going to assess for JVD. If I could have you please, at a 45-degree angle, to turn her head, and I'm just assessing for any distension, and the patient is negative for JVD. Okay, so now we're going to assess your cranial nerves. I'm going to start with cranial nerve number 1. Could you please smell this and tell me what it is?
Coffee.
Okay, so cranial nerve 1 is intact. Cranial nerve 2 has already been assessed by my CNA when she had you perform that Snellen chart test, and that was within normal range, so cranial nerve 2 is intact. Next, we're going to move on to cranial nerves 3, 4, and 6. I'm just going to shine my light, and you just take your eyes and look straight ahead. I'm going to shine it right into your pupil. Okay. So with my pen, I'm just going to have you just follow it with your eyes and not move your head. Okay, so pupils are equal, round, reactive to light, in accommodation. So cranial nerves 3, 4, and 6 are intact. Next, I'm going to check for cranial nerve number 5. Just tell me if you feel this.
Yes.
Okay, so cranial nerve 5 is intact. And then could you clench your teeth? Okay, could you smile? Could you puff your cheeks? Could you take your eyebrows and... Okay, so cranial nerve 7 is intact. So now we're going to move on to cranial nerve number 8. I'm going to have you cover this ear, please. I'm going to whisper and you just tell me what I say.
Apple, banana, orange.
Okay, cover your other ear, and then...
Orange, banana, tomato.
Okay, very good. So cranial nerve 8 is intact. I'm also going to be assessing for a Romberg and gait imbalance. So if I could please have you stand up and walk this way, and then walk towards me. Okay, and then if you could stand straight with your arms together, and then close your eyes, please. Okay, very good. You can have a seat. So patient was negative for Romberg test, so that cranial 8 is still intact. Okay, so now we're going to move on to assessing cranial nerves 9, 10, and 12. For these, I'm going to have you stick your tongue out, and then move your tongue back and forth. Okay, swallow. Okay, and then I'm going to check your gag reflex. If you can open up, please. Okay, okay, so cranial nerves 9, 10, and 12 are intact. And then finally, cranial nerve number 11, you could just shrug your shoulders. No, I'm sorry, push up on me. There you go, thank you. So your accessory muscle, cranial nerve number 12 is intact. Finally, we're checking cerebellum. So if you could just, this is upper, if you could take your fingers, go really fast. Okay, very good. And then for lower, if you could take the heel and just run it under the opposite leg shin. Very good, do it on the other side. Okay, so the upper and lower are intact, so very good. So now we're going to move on to checking for your chest. So overall, I'm looking at your thoracic cage for symmetry. From this angle, it is symmetric. I'm going to have you lean forward. I'm going to place my hands on either side and have you breathe in. Okay, I'm palpating, it is symmetric. The patient is not having any abnormalities with breathing. So now I'm going to move on to assessing her skin color. It is, again, continued to be appropriate for her race. It's dry, it's warm to the touch. I'm assessing for skin tenting and turgor. It is negative. There's no edema, no swelling or issues there. So now we're going to move on to assessing your heart. Okay, I'm going to start on the right second intercostal. I'm listening for the aortic. The S2 is louder than S1. Then I'm going to move it to the left side, second intercostal to the pulmonic, where the S2 is louder than S1. And then I'm going to go down with the bell of my stethoscope and listen to Erb's point, where S1 and S2 will be equal. Then I will move on with the diaphragm to the tricuspid, where S1 will be greater than S2, and the mitral, where S2 or S1 will be greater than S2. Okay. Then, if I could have you lean forward, please. I'm going to listen to her apical pulse for a full minute on a bare chest. All of this would be done on a bare chest. Okay, thank you very much. Now we're going to start with breathing. So whenever you feel my stethoscope, please take a breath in. Okay, could you lean forward, please? Okay, and then, so I did anterior, posterior, I'm going to do laterally. And then do your other side. Okay, very good. There's no adventitious lung sounds. There are no crackles, no rhonchi. Everything sounded normal, so that's good. Okay, so now we're going to move down to assessing, like, can you feel the sensation on your arms?
Yes.
Okay, I'm going to assess your brachial pulses, and they are equal bilaterally 2+, and then I'm going to assess your radial pulses. They're equally bilaterally 2+, and then could you just squeeze my fingers, please? Okay, and then for your hands, could you push up on the hands? Okay, could you push down on my hands? Okay, and then I'm going to assess your range of motion. Could you go in, and then out, and then up, and to the sides? Do you feel any pain doing any of that?
No.
Okay, so range of motion is intact, and then your capillary refill is less than 3 seconds. Okay, and then again, the skin on this area is dry and warm to the touch. So now I'm going to check your deep tendon reflexes, assessing this is your triceps. Okay, and then I'm going to assess your biceps, and then your brachioradialis. Okay, very good, thank you. So the deep tendon reflexes are intact. So now I'm going to move down into your abdomen. I'm first inspecting it for any lesions or the skin color and everything, scars or anything along those lines, hernias. Upon inspection, there's nothing noted. So I'm going to start by auscultating your abdomen. I'm going to start in the right lower quadrant, move up to the right upper quadrant, left upper quadrant, left lower quadrant, and then I'm also going to use my bell to assess for any abdominal artery for bruits. There's none noted there. Okay, when was the last time you had a bowel movement?
Yesterday.
Okay, and what color was the consistency?
Brown.
And then, what was the consistency?
Solid.
Solid, okay. And the last time you urinated?
2 hours ago.
Okay, and then was it the color of the urine?
Yellow.
And then was it cloudy or clear?
Clear.
Was there any pain?
No.
Okay, so now I'm gonna proceed. I'm just gonna percuss. I'm gonna take my hand and just pound in this area. Tympanic, and then I'm gonna lightly palpate from starting with the right lower, right upper, left upper, left lower. Any pain?
No.
Okay, so there's no pain during the palpation, so everything feels normal there. Okay, so now we're going to move down to the lower extremities. Overall, I'm assessing for the skin color, and it's warm to the touch. It's dry. There's no scars or anything noted here. So I'm going to start with you just doing some range of motion. Could you lift your legs up, please? Okay, down, and then out, and then in. Okay, and then for feet, can you press up, down? Okay, and then I'm checking your capillary refills. They're less than 3 seconds. So the muscle strength is strong. I'd rate it about a 5. I'm also going to be checking your popliteal pulses. They are equal bilaterally 2+. I'm going to be checking your posterior tibialis pulses, equal bilaterally 2+. Your dorsalis medius pulses, equal bilaterally 2+. And then finally, I would like to check your patella reflexes. If I could have you come over to the side of the bed, please. Okay. Okay, ready? Okay, very good. So those was a positive response. So, all right, so I believe this concludes my head to toe assessment. Are there any other concerns that you have?
No.
Okay, thank you very much, and the doctor will be in with you shortly.